Early or delayed cardioversion in recent onset atrial fibrillation, a signature of medical English. My name Michael Benoit Freire Freire. In the abstract, we can find a patient with recent onset atrial fibrillation commonly undergo immediate restoration of sinus rhythm by pharmacological or electrical cardioversion. However, whether immediate restoration of sinus rhythm is necessary is not known, since atrial fibrillation often terminates spontaneously.
Your heart is a muscle that pumps blood around your body. It's made up of 4 chambers, 2 at the top called the atria, and 2 at the bottom called the ventricles. Your sinus node sends out electrical impulses. Atrial fibrillation, or AF for short, is when other areas of the atria send out electrical impulses too. These irregular impulses cause the atria to twitch. When this happens, blood isn't pumped out effectively, which could cause a blood clot to form. If this clot travels to your brain, it can lead to a stroke. When your heart isn't pumping blood properly, it can lead to symptoms such as tiredness, dizziness, or feeling faint, shortness of breath, or palpitations. How AF affects you will determine the treatment you need. Some people with AF, like Harry, only have mild symptoms, or may not experience any symptoms at all. Harry noticed something might not be right when he felt his pulse was irregular, and sometimes fast. Harry was at higher risk of AF because of his age and high blood pressure. Those with a heart valve problem are also at a high risk. It's important that Harry avoids further strain on his heart by getting treatment for his AF to reduce his risk of stroke or heart failure. The best course of treatment for Harry was anticoagulant medicine, called warfarin, to reduce his risk of having a stroke, followed by a cardioversion, to try and restore his normal heart rhythm. However, some people may need other treatment, such as ablation or other suitable medication. Thanks to his treatment, Harry's AF is manageable and he can return to work and exercise when he feels ready. For more information on living with atrial fibrillation, visit bhf.org.uk/AFib. BHF. Beat heartbreak forever.
In the methods is a multicenter randomized open-label non-inferiority trial we randomly assign a patient with hemodynamically stable recent onset less than 36 hours symptomatic atrial fibrillation in the emergency department to be treated with a wait-and-see approach or early cardioversion.
Hi, I'm Dr. Wes Fisher, Director of Cardiac Electrophysiology.
Hello, I'm Dr. Jose Nazari, a cardiac electrophysiologist.
Hello, I'm Dr. Alex Verro, cardiac electrophysiologist.
Atrial fibrillation is a condition that results in rapid, uncontrolled heart contractions. It is the most common rhythm disturbance there is. It affects 2.4 million Americans. Today, we want to talk to you about what atrial fibrillation is, what causes it, and how it can be treated.
We believe that the more you know about your condition, the better prepared you will be for its treatment. And with that knowledge will come greater confidence and peace of mind.
Now, before we talk about atrial fibrillation, let's take a step back and look at the normal functioning of the heart.
The results: the presence of sinus rhythm at 4 weeks occurred in 193 or 2012 patients, the 91%. In the delayed cardioversion group and in 202 of 215 in the early cardioversion group represent the sinus rhythm within 48 hours occurs spontaneously in 150 or 218 patients, and after delayed cardioversion in 61 patients.
Cardioversion is a recommended approach to convert atrial fibrillation or flutter to sinus rhythm in patients with persistent non-valvular atrial fibrillation who remain symptomatic despite rate control therapy, or in whom rate control therapy does not control symptoms and who are unlikely to convert spontaneously. Cardioversion can be accomplished electrically or pharmacologically using antiarrhythmic drugs. Electrical cardioversion restores sinus rhythm in approximately 85% of patients with atrial fibrillation, and pharmacological cardioversion has success rates of about 70% in patients with recent onset AF. By virtue of restoring sinus rhythm, cardioversion can also improve AF-related symptoms. Effective anticoagulation is required before and after cardioversion procedures. This is because of the increased risk of stroke during the pericardioversion period, irrespective of CHADS 2 score. Notably, the 1-month risk of stroke or systemic embolism has historically been estimated at 1.9% with no anticoagulation versus 0.36% with warfarin based on observational trials. More recent RCTs of non-vitamin K antagonist oral anticoagulants, or NOACs, suggest that the rate with warfarin is 0.46% and 0.31% with NOACs. This benefit is balanced against the risk of major bleeding associated with anticoagulation, estimated at 0.67% with warfarin and 0.58% with NOACs based on RCTs. The increased risk of stroke during the pericardioversion period can be conceptualized as two distinct mechanisms. The first is the generation of thrombi during persistent AF with subsequent embolization after restoration of atrial contraction. The second relates to a period of atrial stunning of variable duration after the restoration of sinus rhythm, leading to the formation of new thromboembolism post-cardioversion. This is why effective anticoagulation is required before and after cardioversion procedures.
In the conclusion, the patients presenting to the emergency department with recent onset symptomatic atrial fibrillation, a wait-and-see approach was not inferior to early cardioversion in achieving a return to sinus rhythm at 4 weeks.
If you have an abnormal heart rhythm, your doctor may perform electrical cardioversion, where he or she uses an electrical shock to restore your normal heartbeat. The heart normally beats in a regular rhythm at 60 to 100 beats per minute. This steady and coordinated rhythm allows the heart to effectively pump blood. Electrical signals that travel through the heart control the heart's rhythm. These electrical signals start in a cluster of cells called the sinoatrial node, or pacemaker. The sinoatrial node, or SA node, is located in the wall of the right upper chamber of the heart, called the right atrium. When the electrical signals reach the heart muscle, they cause it to contract and pump blood. An abnormal heart rhythm is called an arrhythmia. During atrial fibrillation, the atria quiver because of chaotic electrical signals in the heart, resulting in an abnormally fast or irregular heartbeat. Because of the abnormal heartbeat, blood may pool in the atria, which can result in the formation of a blood clot. If the blood clot passes into the general circulation, it may cause a stroke.
Thank you very much.